Ms. Fisher, and thank you so much again for joining us for our Bold and Courageous Conversations series. Our first question for you today is: what can we do to reduce stigma against people living with HIV?
Hello, I am Fisher Smith, the director of the Lane College HBCU Wellness Project. The HBCU Wellness Project is sponsored by Meharry Medical College and is located on 3 campuses across the state of Tennessee. The primary goal of the HBCU Wellness Project is to promote health and modify risks for chronic diseases among individuals living in surrounding communities. Let me start off by saying breaking down any stigma associated with HIV is a very critical part in ending the HIV epidemic. Stigma can negatively affect the health and well-being of people who live with HIV by discouraging some individuals from learning their HIV status, accessing treatment, or staying in the care. HIV stigma can also affect those at risk for HIV by discouraging them to seek HIV prevention tools, testing, and talking openly about with their sex partners about safer sex, HIV, and safer sex options. A way to stand up to stigma is to talk about stigma. Use supportive language and not stigmatizing language. Speak out to correct myths and stereotypes and educate yourself and others about HIV. As young healthcare providers, people who are going into public health, we need to learn how to use the correct language when we're speaking about HIV. Instead of saying AIDS, we can say HIV and AIDS. Instead of saying to catch AIDS or to catch HIV or to pass on HIV, you would use terms such as to be diagnosed with HIV or to acquire HIV or to transmit HIV. Another thing is, instead of just saying unprotected sex, you would say sex without a condom or medicines to prevent the treatment or HIV. You just don't want to use the negative connotations when you're dealing with HIV. And you just want to be really careful of the language. Also, self-education. If you learn the correct terminology, if you learn the facts about HIV, share those in your community, share those in your work. Also, get inspired and get people's personal stories who are living healthy with HIV. Learn more. You check on the CDC's website. There's information on there of how to address stigmas. Each person plays a role into stopping the stigma, and it gives a voice to people living with HIV as well as their family and friends. Another thing is to do is get involved. Give your time to people who have been affected by HIV. Give your time to HIV-related efforts, testing events, and things of that nature. So if we take these small steps, it would help address the stigma of HIV.
The last question for you, Ms. Fisher, is: what are some concepts and challenges to acknowledge when attempting community engagement?
When you are trying to engage the community, populations who are disproportionately affected by HIV are also affected by stigma due to things such as gender, sexual orientation, gender identity, race, drug use, or even sex workers. So when you are trying to engage the community, you have those barriers in place. A lot of the people who really need to hear your message, or a lot of people who really need the intervention, may feel ashamed to come out to the events. They may feel ashamed to engage. So stigma drives a whole lot of obstacles. So what we have to do is meet people where they are. Your engagement may not be in a clinical setting. You have to go out deep into the community. Well, we do it Lane College, we train students to be student health ambassadors. We train young, vibrant students, and they are able to go places and do things that your average healthcare professional would not be able to do. A lot of people see college students as people who are not invasive. People see college students for people who are looking with their unbiased eye. So we train these college students on HIV and several other topics to go in the community and engage the community on several health topics. And we've been doing this for about 10 years. And in our area, we have moved the needle in a positive way by engaging college students in their communities. We do that in Jackson, Tennessee. We do this at Meharry Medical College. There's another school, Fisk University, and also LeMoyne College. So engagement becomes like a service learning program for our students, and they are able to go out and reach populations that the average health worker would not be able to reach.